Okay, the geniuses will see us now.
I'm a pro.
He's very unprofessional.
Very unprofessional.
These are our newly arrived surgeons, Doctors Trowbridge and Greenbaum.
Doctor?
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 We're not doctors.
Are you sure they can handle this?
Oh, we can handle it. We're professionals.
You'll forgive us if we're not instilled with confidence.
Potentially unprofessional pieces of content.
Welcome to Unprofessional. I am Trevor. This is
Ken.
And we're doing this podcast because we have nothing better to do.
Speak for yourself. We're coming from Brooklyn, New York, live.
Brooklyn, New York.
Whenever you're listening.
We
back in person for this one.
Yep, that's right. That's
COVID's
right.
done.
And we're talking current events and health and medicine, trying to make each other laugh a little bit. And we got some advice for you, some fun facts. We'll hit you with everything. We'll do a fucking rap at the end. Screw it.
Yeah.
Okay.
Let me start off.
Go ahead.
News. So I saw a video last week. My fellow showed it to me, the one I'm working with, and he was saying this African village, not racist. They had a lot of COVID spreading, and there was a rumor going around that circumcision is a way to prevent it. And so what the video entails basically is all these guys in a fucking line getting their foreskin chopped off with a knife. And
like a machete?
No, it was like it was a pretty big knife. It wasn't a machete, but so the guys just like come up, stick their fucking dick out, and the guy pulls it and just cuts it with the knife. Doesn't even like measure anything. Just fucking goes.
He just goes from penis to penis with a knife?
Yeah,
the same knife?
dude. He doesn't clean it, nothing. And so what I saw, like, first of all the guys are fucking hung, bro.
Come on, man.
You have to mention it. And when the guy cuts it, you can see the white, dude. The skin's coming off, the white fat underneath.
Oh, damn.
It was the most disgusting video I've ever seen.
How old are the people?
The guys that I saw were like probably in their 20s or something.
Damn.
Like they were young, but it was insane, dude.
Hey, man, you gotta do what you gotta do.
I don't know how this stuff spreads.
Oh, the fact that it prevents COVID?
Yeah. Because I guess like my mom gets a lot of this like information, not like this specific one.
Your mom cut her dick skin off?
Yeah, she cut mine off for that reason.
Oh, damn.
And it's just these Facebook, or not Facebook, like WhatsApp groups. They spread so much information. No one double checks it. No one knows better. So they just follow.
WhatsApp groups, really?
Yeah.
You're talking about like group chats?
Yeah.
Okay.
People just send forward.
But then where do they? Okay, yeah, but they get the original thing from like a Facebook message or you know like a Facebook post or something.
It could
right?
be. So it's like sometimes it's a text, sometimes it's a picture.
Okay, so I'm friends with a couple like guys from Karnataka, India, because I went there for like a pre-med trip. Okay.
Oh yeah.
And they're like straight up from there. You know what I mean? Like you would hate them. They're poor as shit. Have no money. But no, they're so from India or that part. Like the stuff they post on Facebook is just hilarious to me. Just mostly because I don't understand it, or it's just like it's just so goofy. You know, it's like when we first got introduced to memes and stuff. Like they're just they just are like figuring it out type of a thing. It's like it's kind of cute.
They're a little behind when the memes.
Which is totally understandable.
They're back in like 2000.
But yeah,
graphics.
they'll also post like COVID, like just the best shit. Like you just like here's the cure for COVID.
Yeah.
Mix like balsamic vinaigrette with like salt, the nail of a newborn, and like some other shit, and you're like, wow, like that's it, huh?
If it's on a graphic and there's big text and there's like a smiley face or some emoji, it can't be proven false.
That's right. And if they garnered my attention with like some boobs or something, then
a lot of people believe it. Like still, my mom, when I have a sore throat, she's like, "Oh, you should have like garlic water and it'll help." And I'm like, "What's that gonna help?" Like maybe it'll help the symptoms.
Well, my favorite is and I'm sure I have examples too where I'm a dumbass, but my favorite is when medical students or people in our profession are like, "Oh yeah, drink this thing," and you're like, "I'm confident that there's no data that helps."
Where's the science?
Yeah, but it's interesting to see people say that. And then one time, this one guy we knew, we were talking about cutting facial hair and whether it would grow back faster if you cut it more often. And I'm like, and he was convinced that that's how it works. He's like, dude, shave if you want more. I'm like, I'm sure that doesn't increase the growth.
I think if we did a poll, it would be majority saying it grows back faster.
Yeah, that's kind of interesting.
Because I've
We
heard
should do
that since like elementary school.
Yeah.
And
Yeah.
like even my parents were like, they told me not to shave in high school because they're like, if you shave now, it's gonna come back faster.
Oh, you guys are
And
anti-hair? I think I'm pro-hair.
you need to cut it more often.
Yeah, I want more.
They're just like, you don't want to have to deal with that right now. Just if you postpone it a little bit, you can deal with it later on.
Yeah.
So they were anti.
And then if I have to go into surgery, though, then they got to shave that shit off, though. They got to shave it and so they can get in there.
You should be happy, man.
Yeah.
You should
Why?
start cutting off like the tiny hairs on your chest so you can finally get some.
Oh, so I'm like a mole rat almost, like the amount of hair that I have, which is
Naked
zero.
mole rat.
And
I think you have like a beard and pubes and that's it. Right?
yeah, I mean, if you call it a beard. And so one time I went out, this was at SGU, and I had like my chest showing with my button shirt.
Yeah.
And the girl, like these girls came up, they're like, "Oh, so you shaved your chest for this?" And I'm like, I'm like, this is a lose. Like, I'm all right. Like, yeah.
No, I don't have
Yeah,
any chest
yeah.
hair.
No, I can't do that.
How do you respond to that?
I just say yes. I just agree. That's actually what I do for all of it.
Do you wanna
I just
touch
keep
it?
agreeing until we're like home.
I'll let you touch it if you want.
Yeah, dude, that works for sure. All right, so I'm gonna go. So I'm in the family medicine clinic, and this is pretty good. We had this like little Mexican lady. I don't know. She's whatever, like 50.
Why did you mention the race, bro?
I don't know. Why do I do that?
Just tell I don't.
We're trying to get away from being racist.
I don't
on this
care about the
podcast.
race. Tell me about her income status. Was she on
But
Medicaid?
sometimes that matters, you know? Sometimes it does. Maybe I just shouldn't mention
Not for
it.
the pod. Just tell me their income status, okay? I don't care about anything else.
Okay.
All right, so she's low
So this
income.
really poor lady okay, so this lady comes in. She's probably 50. She speaks only Spanish.
Okay.
Okay, maybe it was important for the story. So she speaks only Spanish, and we're trying to get her to, I think take the booster, some kind of vaccine. Maybe it's shingles or something. I don't know. And so we're gonna give it to her, right? She's like, agrees. When we're in the room, then we go out, and the guy's gonna give the vaccine, right? Some kind of nurse. He's this large, boisterous man. I won't say his race because it's not important. It's not important.
Yeah.
But he's probably poor, and he's gonna give the vaccine, right? That's what he does. So, but she looks at him and just immediately says, "No, I refuse. I refuse." And now it's probably important I point out the race. This is a large, boisterous black man. I don't know if she said she doesn't want the vaccine because he's a black man or because he's loud, but she was just convinced. She's like, I am absolutely not receiving this from him.
Wow.
And he's like very experienced, knows what he's doing. He's super sweet too. He's a very funny, like cool guy. But she just does not want it. First glance, I'm like, okay. I'm like, can I do it for you? She looks at me for a while. Okay. I'm like, okay. Never given a vaccine in my whole life. Zero experience with this. So I go up to the guy who gives the vaccines, and I'm like, all right, can you teach me? Because she doesn't want to get it from you. He's like, all right, well, I don't give a shit if she gets it or not, but I'll teach you. I'm like, all right, cool. And so he teaches me. I go up and do it so poorly, like none of the stuff I was supposed to do, but I give it to her, right? So whatever, I take the cap off. I have to ask someone to help me to take the fucking cap off, and I give it to her. I pretty much forget to just tell her I'm about to inject this thing in you. I don't do 3, 2, 1 and then hit her. I pretty much just go, but I hit it and I pull out. Not my greatest skill, and then I don't know how to recap it, so I just hand it to the person next to me. All the nurses are like, oh my god, don't do that. It's a fucking open needle. And then it was over with. But she would rather have me,
inexperienced
who has never done it before.
White.
Yeah,
middle class
that's fair.
person, med student,
I'll take that.
do it over
Over this
someone
large,
who's,
boisterous man.
Obviously none of that matters. It's the skin color, obviously.
It's probably the skin color.
It's the only thing it is.
I don't know why. It's really it seems insane, but I think that's what it was.
Wow.
Maybe it's just because he was really loud too. I don't know. And she just like, maybe he'll hit me hard with the vaccine because he's also loud. I don't know.
He's gonna go through her arm.
Yeah,
He's
I
big,
don't know.
man. How could you mess up giving a vaccine? Isn't it pretty simple?
It is very simple. I guess I just
Stick it
didn't do
in.
all the protocols, which is what I did. I put it in, and then cummed it out or whatever. But yeah, when I pulled out, I didn't like recap it. It was the main thing. Also, when I was going in, I squeezed I had a little pre-cum before I actually put it into her arm.
Yeah.
So
When I
maybe
was
that's
getting-
not the best analogy.
When I
but-
was getting my booster, it was this girl, and she did the most smooth vaccine I've ever had. Like, it took
How
less
so?
than 2 seconds.
it was just all in one motion.
Yeah, she put in a bandage, so it was ready to go. So it was half on. She put the needle in, stuck it, took it out, and I honestly didn't even feel it going in. It was that amazing, and I was like, "Wow, are you sure you gave it to me?" And she
Can
was like,
technique matter though? Does it matter?
Yeah. I think it does.
Okay,
It does
I
a
guess
lot.
I don't know. I've done it one time, and it was 2 days ago. So
I'm sure you'll get worse before you get better. I don't know if you'll get better yet.
Thanks.
Actually.
Jesus. All right, so I'm going into an ED rotation in a few weeks. It's gonna be 12-hour shifts. It's a trauma center. Yeah, it's in the Bronx. Yeah, and I gotta impress him because I'm trying to get a slow out of it, which is like our letter of recommendation for emergency medicine, and yeah, I gotta do work. So I'm a little bit not stressed out about it, but I gotta do work. So I practiced suturing last night, and
Wow.
yeah, I did the whole shebang. We have like this little. Most people have a little silicone pad that you can like practice on.
Have you heard about anything about the rotation? If it's like
Yeah, I've heard it's
intensive?
good, but like kind of intense. And if you have done things in the past, like if you have experience at different procedures, then it helps a lot. Like, and you can kind of hold your own. So, for instance, I know how to do an IV, put an IV in a patient, and so I'll just be able to do that. Whereas apparently a lot of students aren't able to. Like, they'll come to that rotation not having done it before.
Wow.
And then, no one wants to teach you anything, which is funny because it's medical school, but no one wants to teach you anything. So if you haven't done it before, you either have to fake that you've done it before, and just try it without having done it, or you've done it before and then you just can do it. And if you haven't and you say you haven't, then they won't do anything with you and you just can't do it. Which is actually how I did my first sutures. So I knew he looked at me and asked in the ED, "Have you done sutures before?" And he gave a look like, "If you say no, I'm not gonna let you do it." And I'm like, "Yes, I have done it." He's like, "Are you
Always say
sure?" Like you made it seem like. I'm like, "Yes, I've done it." He's like, "All right, fuck it." So he doesn't even observe me. He just walks out. I'm like, "Oh my god!"
never trust
I'm doing it
messages.
at this like goofy ass angle on like the elbow, and I'm just trying to not shake and like be confident. And it's like a feeling of like a first date. I've never done this before, and you're just very nervous,
Yeah.
but you need to not show that. So you just go into it and try to just be like, act like you've done this 100 times. Otherwise it's not going to go good. And she kept like testing throughout it. "Oh, so, have you done this before?" Like straight up asking, or like, different questions about it. Or I'm like, "Oh yeah, this and that." And then one, I didn't even know the answer at the time, but she's like, do I need a tetanus shot?" And I was not sure. And so she had been cut by glass.
Yeah.
And I wasn't sure whether you need a tetanus shot for that. I was like, I think in general you're supposed to have it no matter what you get cut with.
Fuck it.
But I said no. I was like, I don't think you do. And then the doctor comes in. He's like, "So, okay, we got you all sutured up. We're going to have you get a tetanus shot." And she's like, "I am? Do I need that?" And then he looked at me. He's like, "Yeah."
If the glass didn't do it, this med student did it.
Yeah. But yeah, it went good. It went fine. It's just, if I started to like break down and not show confidence what I was doing, she would have been like, "Okay, let's not do this," and then like, let's get someone else in here.
So
But-
what's the difference between like going to a trauma center? What are you gonna see there
Rather
rather than a regular?
probably
ED?
trauma.
Yeah, I would guess.
No,
I
just
heard
like
some
gunshots
stories.
and stuff can actually
Yeah.
come in there. They don't instead of it, unless it's right outside of our old hospital, we wouldn't get a gunshot. But if it's like 2 streets down, they'll send it to a different hospital just because it's a trauma center.
Yeah, I actually heard that there was a lot of gunshot wounds that were coming in to that hospital. Actually, one guy was shot in his car, and he was like a pimp or something, and he got shot like 6 times, and he came in to this same hospital, and he survived.
I mean, yeah, I'm sure that happens. I'm sure
Yeah.
we actually help our patients.
You're gonna be the one doing compressions on him.
Yeah, we treat pimps as well, man.
You know, speaking of, I had a crazy story.
Did he say that? Do you think pimps put down on their like applications and stuff that
For taxes and
yeah,
stuff?
their last like 2 years they've been a pimp?
They make their money somehow. I feel like they wouldn't, because then they wouldn't have to like.
Yeah, they wouldn't do that,
Like
right?
you could get welfare if you wanted.
I mean,
to.
being a pimp is an illegal activity.
Is it?
Yeah. You
He's
can't
running
sell off
bitches.
women's bodies for sex.
If they allow it, then why not?
Okay, if they
Sex
allow
work
it,
should
but,
be
but
real
it's not
work.
legal.
It's a great job, and I want it. And if I couldn't do that, I would do
If you weren't a doctor, you'd be a sex worker or a
Exactly.
pimp.
pimp.
You
bro,
could not
of
be a
course.
pimp, dude.
I'm trying to start an OnlyFans for sure.
It's not going to be successful.
You never know.
They're looking for goofy looking like Pakistani guys on there.
Goofy.
Is that?
Hey, why are we talking about race again? This is a race-free podcast.
Oh, that's right.
If they like guys,
We are going to get better.
like a light switch, then I'm their man.
Okay, this is stupid.
Let me tell you my story.
Okay, go.
So it's like part annoying, part good. So I got a consult. It was a super old lady. She was like 93. I'm not gonna say her income or race.
Good.
You know, we're getting away from that.
We're better than that.
And when I was reading through her chart, like it was so stupid. Whatever resident it was took the worst notes ever. I read two of her notes, and I had no idea what was going on. And you know, you have to put a reason for why you're consulting a specific like specialty. And she said, I'm consulting nephrology because this person has worsening like kidney disease. But no like context of like what's been going on, you know, how she's been on her hospital course. She's like, she came in for weakness. She had fucking meningitis, and then now she needs this. But that was 2 weeks ago, so I have no idea what's been going on since then. So I did a lot of research. You know, her notes fucking sucked. And even her, like, at the end, her summary, her things are out of date, because she said her, like, the white blood cell count, the ones that fight infection, were 16,000. But that was 2 days old. It
And
was
that's
20,000
that's pretty
now.
high. And when he
Yeah.
says notes, he's talking about what other physicians have like written about the patient. So
Yeah.
if they write a poor note, a bad note, then we don't know what's been happening because
in
we
this
don't have
case.
anything written down.
Yeah, so I went to go see the patient, and it said like the patient was examined this morning at 7:30, and I went at 9:30, so 2 hours later, and it said the patient was lethargic, so she's like tired, but she responds to
And she said meningitis for 2 days.
since she came in, but meningitis was like gone now.
Oh, okay.
But she was apparently lethargic, but still answering questions, you know, yes or no answers. I went to see her. She looked fucking dead, bro. Like, I walked into the room, her eyes were open. She was not blinking. She was breathing.
Shit.
Yeah, her oxygen was low. Her
Were you
like,
freaking out a little bit?
kind of. But I was like,
Did you go for a pulse right away? What was your first move?
my first move was just to like.
Was she
listen-
set up to the monitor?
Yeah, she
Oh.
was.
So okay, so you could see her.
Her heart was
heartbeat.
beating. You know, she was breathing. I could see that. And I listened to her lungs and heart. I could hear, but her heart sounded really weak. And then I was like pressing her stomach. She wasn't responding. I did a sternal rub where you like rub the sternum, just to get them to react to pain. She didn't respond, and her right leg was super warm and her left leg was super cold. So she might have had a clot or something.
Yeah.
So I find my findings. I go prepare my presentation for the attending, and finally an hour later we get around to seeing the patient.
Damn. Maybe you should have presented it before.
Well, it was his decision when we round, and I'm like presenting the thing, and he's like, "What do you think is going on?" I think, well, she has like sepsis. She has like a infection or something, and it's causing her to have this deterioration.
Altered mental status
And she was coming back from like a CT scan or something at this exact time we were sitting outside the room.
Jeez, they just took her like floppy body into the CT scan.
Dude, when she came back, she looked fucking dead. She looked
Jeez.
pale as hell. And so the attending's like, maybe we should go in the room because she didn't look good at all. He's like, you can see, like, she looks really poor. And the nurse was in her room, like, putting her back to the monitor. And we're like, we couldn't see any chest rise. And her mouth was literally open. She was like,
Oh, shit.
head back, mouth open.
Like straight up dying.
Yeah. And when she hooked her up to the monitor, her respiratory rate was 6.
Oh shit.
And so the resident was like, she's not breathing. And the nurse was like, she looked at the monitor. She's like, yes, she is. It's 6. And 6 is not good. Normal is
Such
like
a low number.
normal is like 12 to 18.
Yeah.
And so the resident's like, okay, you have to go call a code right now or she's gonna die in like 2 minutes.
Yeah.
And she's like, I know, I'm just doing these pads first. And
Oh my god.
the nurse
Yeah.
was getting very defensive because she was like, oh fuck, this patient's
Yeah.
like gonna die and
Yeah,
I'm
like-
doing shit. And so she like hooked her up to the monitor. She's still going, and the resident just fucking books it out of the
Oh my
room
God,
and
yeah.
goes and calls a code. And the team is nowhere to be found. They bring a crash cart. I get in there. We all glove up so we can start compressions. We raise the bed.
Well, that's such an annoying thing though when people are defensive when someone's literally
I know,
dying.
dude.
Like, pick another time, man.
It was
for your fucking pride.
It was a weird response to the question because I'm like, just go call the code. This is not important. Why are you putting fucking pads on her chest?
Yeah.
Like, we need to like
That is
save her.
secondary. Definitely secondary.
So we got the crash cart. We started giving her stuff. We give her epinephrine. At this point, like, her breathing is getting slower. Her heart
You're
rate.
intubating at that point, or no?
We were getting to it, so we didn't know her code status.
You only need the positive pressure, right?
She was already on positive pressure.
Oh, and that wasn't working?
No.
Huh.
It was weird because she's do not intubate. We can't intubate her, so
Oh.
she has CPAP or something. And we didn't know what her code status was at that time, so we didn't know if the family wanted us to save her or not. She's 93, so like, what are we even saving? So, the team was nowhere to be found, and so we called the code, and we started compressions. And like the other guy on my team, he was doing it for like a minute. He was fucking dying, and then
Did you hop on first? No.
No, I was third in line.
You don't want to be a hero.
I want to be a villain, bro.
Oh.
And
You want her to die under your hands.
shoot, her family needs to like, get rid of her already.
Damn.
Just
All
kidding.
right.
I don't think that.
You are a villain.
So the guy is like, "Oh fuck, I just broke all her ribs."
He said that?
Yeah.
Out loud?
Yeah.
It's a little unprofessional. I think.
He should be on the pod.
Yeah. Damn.
And
Fuck, I just fucking fractured all her ribs. Holy shit.
And then, the other resident goes, and then at this point it's been like 2 minutes. And then she's getting tired, and she's like, I can't get a good like angle on him. So the other student goes, and then I was up after, and the guy's like, he was fucking ready, bro. He took his stethoscope off, he took his white coat off.
Oh, he's ready to go.
He took his glasses off.
Rolled his sleeves up.
He was, yeah, exactly.
Pulled his glasses off like,
He was getting prepared as if he's ready to go for the next fucking 20 minutes
let's
if
go.
he has to.
I'm all about it.
And so he starts perfect form, going fucking.
Who is
8
this?
inch-
Is a med student?
Yeah. Not 2 inches deep. He's going fucking 8 inches deep, bro. He's going through
Hey.
the bed. And
I
as
mean,
soon
that's
as
not a good thing.
as soon as he starts, they're like, "Oh, she's DNR, DNI. Do not resuscitate, do not intubate." So they're like, "Okay, stop resuscitating her," and he's not stopping. He does like 5 more. We had to like hold him back. He's like, "Bro, stop!" At
It's
this
like, hold me back, hold me back.
at this point, all her ribs are broken, and like, we had to take her like shirt off or whatever to like listen to her heart and like check shit. And she had bruising all over her chest because like
Dude just
of the
went
broken
off,
ribs.
huh?
Yeah, dude.
Fucking monster.
And it was just a terrible, terrible case. Like,
I'll put that on my Tinder profile. Monster at compression. Go 8 inches deep. Yeah, no,
you're gonna get their hopes up.
I put on the profile. I'm 8 inches, and then I meet up. They're like, "This isn't 8 inches." I'm like, "Well, I meant my compressions." Like, what the fuck?
What the fuck are you talking about? And what happened next? So the other team came back and they told us all to stop, and I'm just like, if lawyers look into this and try to sue us, like they're
Bro,
gonna.
that shit happens all the time though.
Yeah.
Haven't you seen that? I've seen that so many times. Where DNI, and we've already set up everything.
It's shameful because even at the old shitty hospital, they had the code status on the wall.
Yeah, isn't that such an easy fix?
Yeah.
You literally just put a piece of tape that says DNI on the patient.
She's fucking 93. She's getting worse. Why would you not put it on the wall? Everyone knew it on the team, but
There's
they didn't.
so many simple errors that are consistent over all the patients that happen at these hospitals. It's just
Amazing
fucking...
that like this was overlooked, and so this poor lady has all her ribs broken, and the notes fucking suck. If someone wanted to sue, they'd have such an easy job
dude.
suing because of this.
That's like
But-
the theme of this podcast.
Yeah, but if they're 93, it's harder because it's like, she didn't want anything anyway, so what damage did we really do if she's gonna die and her ribs are broken now?
Yeah.
So that was my story on like Wednesday or something, and I don't know, it was interesting. I was pissed the entire day, but when I finished finished all this, I was like, so do I have to write a note for this patient or
man.
keep my recommendation? He's like, no, don't worry about it. I was like,
Yeah.
okay, thanks.
That's complicated.
At least one good thing came out of it.
You're not supposed to say that.
My
bro.
friend got his compressions in.
Oh, I'm happy for him. That actually is a big thing. I mean,
Yeah.
dude, it's intense. The first time you do compressions, it's a pretty fucking intense moment.
Yeah, and he'd never done it before, so he just
Wait,
stepped
is this
up.
8 inches, man?
Yeah,
Oh, okay.
he'd never done compression, so he just stepped up and he's like, "Fuck it, I'm gonna rock this lady's world. I'm gonna bring her back. I'm gonna bring her
Make her
back."
come in the process.
We were actually like, our team was making fun of him after because he wouldn't stop, and we're
That's
like,
my favorite, dude. When the whole team's just clowning on somebody.
we're like, I won't say his name. We're like, he didn't want to stop until he brought her back from the dead. He was gonna he's single-handedly
I'm
gonna
gonna
bring her
fucking-
back.
I'm gonna beat the soul out of her and then put it back in.
He actually it was good that he kept going because he showed me something that I hadn't seen before. It's called PEA, pulseless electrical activity, and
Oh,
it's like,
that's where just it's blipping on the
Yeah.
EKG. But
so it said her heart rate was 40, but we're like, we couldn't hear anything, so they told us to listen, and yeah, there was no sounds, just like there was electricity, but it wasn't really doing anything.
wait, okay, so if he's still doing compressions, that's when you see the PEA, or is it only when he stops doing compressions?
No, when he stops, because like they're like, listen to the heart, and then we heard and there was nothing.
Okay,
It was a cool experience.
that is cool. I mean, that's one of the reasons I want to get into EM, just because that shit's crazy.
Because you're
I
not
don't know.
stopping until she comes back.
You don't stop, baby. Fucking beat it
Keep
out. of
going.
him.
He had an easy patient. She was like a very frail old lady.
Yeah,
but like
I
when
mean-
that fucking 60-year-old guy who eats cheeseburgers all day coming in for cardiac arrest, it's a bit harder.
Yeah,
bit
definitely.
more,
yeah, the big
resistance
obese
pushing.
ones.
Yeah.
And then the kids, those ones are weird because you have to go faster, but you feel weird compressing
thumbs.
super hard. You're like, I don't want to break all these fucking ribs on this kid, but
Yeah.
you
Have you
wanna
ever done it
push hard
before?
enough. Yeah.
On a
I
kid?
told the story on this podcast.
I don't
Thanks for
remember.
listening, bro.
I remember 10% of the things you said.
So the short on that one is the kid comes in. It was crazy because we just had 3 kids die in the last few days, which is a lot for this
wow.
hospital. Yeah, in the ED, like in the resuscitation bay. But this was the 3rd one. So, spoiler alert.
You didn't save him,
Isn't
huh?
that funny? Kids dying. Okay, so yeah, kid comes in. We were not alerted to this shit very quickly. They were like already in the hospital. We're like, okay. So we all sprint over. We have no intubation tubes ready for children.
Oh, wow.
And we're like, oh my God. And then so someone finally runs and go gets one. And you have to get it to like the direct exact size of the kid. You have to measure the kid and then put the tube in.
Hold on. You can bleep out his name, but like that's where Jeet comes in handy.
Oh, dude. Just speed walk.
Shouldering everyone
boom, 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 boom.
to get this
You
shit.
sing hi to everyone on the way too. Hello, hey, how are you? And just like gunning it, grabs the tube, fucking instant turn. Oh my God. Yeah,
Sorry,
we definitely have to
continue.
bleep that. And okay, patient comes in, whatever. We hop on compressions. They let the medical students do the compressions usually. So we hop on. It's me and 2 other girls. These other girls are not pushing 8 inches.
Oh, yeah.
They are pushing a half an inch, and that is not enough.
It's just
And they
a
are
kid.
going too slow, and they keep being repeatedly told, you have to go faster, you have to go deeper. And that's what I'm constantly told in bed. But we do our best, and these girls are not doing well. So I keep hopping in, right? I'm like, fuck, if I don't hop in, like, this kid is not going to be okay. Like, there's not going to be blood and oxygen going to his brain.
Yeah.
So I keep hopping in, and I'm exhausted. I'm just fucking so tired from doing all these compressions. Definitely broke all their kids' ribs. The belly is getting huge, and it's making the
fuck.
compressions harder. Yeah, which is not
Why
a
is the
good
belly
sign.
getting huge?
So I'm not sure. I mean, what are your thoughts on that?
No fucking idea. He's
So,
bleeding
I
or
mean,
something in there?
I don't know. So he had an allergic reaction. That's what we were thinking. Because
Oh.
she turned around, turned back, and then he couldn't breathe, and things were swelling up. But the belly was getting huge. I don't know whether there's like air going into it, something like that. But the conversions were getting super difficult now. And again, every time the girls hopped on, I'm like, oh my God, this kid's dying now. So I hop back on. I'm just sweating. Bro, I went like 8 inches, guy. I like rolled my sleeves up, threw my stethoscope. And like every once in a while, a resident would help me too. But they're trying to do other shit. And yeah, the kid passed away. It was sad. And the
I
mom,
remember the story.
yeah, the mom was behind us, and then she wasn't making a lot of noise up to that point. I don't think. Maybe I was just in the moment and I didn't hear. But once we called it, you know, the doctor asked if anyone else had any ideas. No, everyone said no, and so she declared time of death. And then you just hear the mom all at once. She's like, my child is dead. My child is dead. And then just like screaming and like wailing. I was like, oh fuck. So you just like clean up around the kid and
Yeah.
yeah.
You
that
got an
shit's
attaboy
crazy.
after that, I think.
Yeah, I did get an attaboy.
That's
yeah.
the main point of the
Yeah,
story,
dude.
bro. Now
That's what we're talking
now
about.
we're coming to the
That's what we're
climax.
talking about, baby.
The doctor comes up and he's like,
Yeah.
good job, Trevor. Good fucking job. And the mom comes up and she's like, thank you. My son
Yeah.
would be happy in heaven because of you.
That's right, yeah.
You
and
brought
then the
him
mom
there.
was like, "You want to get a drink sometime?" Wow, that's probably the worst thing I've ever said.
That's why it's anonymous.
But yeah, no, super fucking sad. And then yeah, I got an attaboy because I just kept hopping on. I was the only one doing compressions right. And yeah, I think it wasn't only an attaboy for doing the compressions right, but for continuously being like, okay, this is not okay. I need to hop back in, you know?
Yeah.
Even though it's not really my turn in the order and I'm doing it too early, but
You know what's surprising? Like, one thing I see on TikTok all the time is that, like, there's so much misinformation. One guy was literally making a video of the safest way to put your toddler into a pool. It's one of the biggest causes of death in kids from 1 to 4, or like
yeah,
0
but
to 4.
you don't have them swim then? I don't get that.
No, you
can
just
have
keep them
swim,
away
right?
from the pool. Like,
Oh, you just don't put them in water.
yeah.
Are you sure?
Why do you take kids? They don't know how to fucking swim.
Well, you got to get tough.
Keep them away. And it's just, there's so much misinformation going around. Some guy was like, you know, how to avoid COVID, and he was doing some of the same things that, like, you were saying before, like, mix all this bullshit together. And then you see in the comments, people are like, oh shit, I'm gonna try this, but like,
Well,
I don't
anyone can say
understand.
anything.
Yeah, but I don't like the ones, like, you're not even supposed to have a pool unless you have a fence around it if you have kids,
Huh.
like, that are under 4.
I didn't know that stuff. But
It's-
yeah.
There's some regulations, like, I'm not sure if it's everywhere, but some places have it, and it's just,
I mean,
you
being able to trust where your information is coming from is so huge, you know. But people, yeah, I guess people throw trust into lots of things, you know.
one thing, yeah, that's just the thing that makes me most angry. Like, stop, you don't know what you're talking about, you're putting it on. Like, the only person who knows what they're talking about is those fucking, like, big boob chicks on TikTok that just shake their ass, and that's
I'll
what I
listen to
want to
them.
see.
Yeah, I'll listen to them.
They're like, go subscribe to my OnlyFans.
I found the
I'm like,
cure
that's
for
the only thing.
COVID. I'm like, yeah, you did.
They're like, I don't even want to say the shit they do. It's just too funny. But that's all I want to see on TikTok. Okay, I don't want to see misinformation. I just want to see these girls.
No, I know, man. I feel you on the misinformation thing. Like, I don't know what to do about it. But yeah, it's interesting. When I was a server back in the day, and
Server or surfer?
I'll lead it up. I'll leave
You
it up
weren't
to
cool enough to be a
interpretation.
fucking
I'll leave it up to interpretation. And a fellow surfer was saying some wild shit on Facebook. But the thing is, she definitely wasn't sure about this. You know, she said something. It was some kind of misinformation about vaginal bleeding, and like, oh, make sure you have your doctor do this test before you give birth, because you could have a DVT and then have a PE and die, because it happened and to this person that I know or whatever. But she had forwarded it from someone else, and so she was pregnant, so she was interested in this type of information at this time. But it's like, you don't know what this is coming from. You have no idea who this person is, like, and you're gonna like retweet this shit, and so everyone else can see it. Like, you don't know anything about this. And
She
then so
believed it.
a bunch of people either were like, wow, half the people were like, wow, that's crazy, and the other half were like, that is not how that works.
Which side were you on?
I didn't say shit.
That's crazy.
I usually just try to stay out of that stuff, but yeah,
You
it
were the
was-
dad in the picture. So.
Oh my god, dude.
So you wanted what was best for the baby,
You
for
fucked
sure.
me up.
Yeah.
Yeah, that's exactly right. It was my child. Yeah, dude, that stuff does bother me, but I don't know what to do about it unless there's like systemic change.
There's got to be
which
something going on.
I don't have the capacity to do.
You know, anything on Twitter
I'm
is
John
just so
Mayer,
divided.
baby. I'm just waiting.
Everyone's just so divided. It's gross.
It's
People need to
too
come back
bad,
together.
man. It definitely makes it so there's gridlock and then no one can do anything productive. Like, everyone's just trying to fight their fellow countryman, as what was said recently on a Z-Dog MD podcast, which is pretty good. You get, if you're interested in this shit at all, you definitely should check out Z-Dog MD. He's us except much smoother, knows much more. But we have more jokes. So,
What kind of
you
a
know.
doctor is he?
He doesn't laugh about dying kids. So. What kind of doctor? He was internal medicine.
Okay.
So he was internal medicine, and then I believe he stopped, and now he does like the podcast, and he had like some kind of like funny like Darth Vader bit where he like wear the Darth Vader mask and then would make jokes about how shitty the medical care system is, as if he was on like the Death Star and like making fun of it.
Yeah.
And apparently I think that's how he kind of blew up. I know
Must
he was
be
making
American.
like parody rap videos about medicine too, and I think that was part of it too. But
Yeah, after going through this, I'm surprised at how shitty the fucking medical system is.
oh, dude, it's crazy. Like, but here's the thing: everyone complains about their job. Everyone complains about the different systems they're a part of. Oh, the law system, this and that. I don't know, man. Medicine, I haven't seen it all, but medicine's fucked, dude. It is fucked. How the patients are treated in various places, the discrepancies in like socioeconomic status and like the treatment that's given from hospital to hospital, the information that's given, and also very important, how the staff is treated and how fucked up that system is. Like there's a reason that all the nurses are leaving and that everyone fucking hates their job, and that, you know, that one nurse that we had in that story earlier was defending herself. It's because everything fucking sucks. And so she's like, well, I'm going to defend myself till the fucking end because this is horrible and I shouldn't be treated this way. And then, you know, some patient's dying and she's like, well, I'm putting the pads on instead of going to get a code. You know, it's not totally her fault.
You know, it's terrible for both reasons. I don't think it's just the system, but the people fucking suck too. Like,
What
everyone
people?
says that, like, they do it for the patients, you know, blah, blah, blah.
Yeah.
But a lot of patients are too entitled. Like, it just blows my mind. You're doing something for them to help them, and they're just being resistant to everything.
But there's better ways to like go about treating those patients, and then there's, I mean, now we're going real deep, but there's like a lot of these patients. Okay, a lot of it comes to like misinformation or not knowing information, so they don't know how to be treated or whatever. But there's also, you know, if your entire like last 3 generations were treated horribly by both, you know, the economic system, the state, the country, and then medicine as well. I mean, you hear tons of fucked up stories about like, you know, Tuskegee and all that shit. Like, so I wouldn't trust this shit either, man.
But I found that
Besides
white
some
people
pigment.
are the most entitled. I feel like black people are fine. You know, Hispanic people don't say shit. You know,
I don't
they're
know.
happy with
I
whatever.
disagree.
You think so?
I would say, well, I don't think that wow, we're just trying not to be racist, dude. How did this happen?
My worst patients have always been like white people.
For me, it's been, I think, black people, but it's not because they're entitled necessarily, but because they don't either trust what's happening. You know, I'll say, look, you know, taking metformin does not cause pelvic pain. Like, it's just not something that happens that we know of. So it's probably something else that's causing that, and you know, that's just, I don't believe you. And it's like, all right, well, you know, I guess we'll just try to something else, you know. But and then there's other times where it's like I'm trying to do an IV on the patient, and they're just like, this is horrible. Like, you should do better than this. The nurse before did this way better, and I'm like sweating trying to get this done. Like, oh my god, it's just making it much harder.
That actually happened exactly to me. This white lady, you know, let's put her race out there. She needed an IV, right? The nurse is gonna do it. The nurse was Hispanic, by the way, so, you know, I'm brown, she's brown, she can't tell the difference. And I asked her if I can put the IV in. She's like, yeah, you know, go ahead. And I put it in. It was a perfect IV. She's like, is it supposed to be hurting this bad? And I was like, is it hurting? Like, what's going on? So I pressed around it. She didn't like really flinch or anything.
Okay.
And it seemed like it was normal pain. I was like, you know, it's gonna hurt. Like, it's not like comfortable. And she's like, can you call the nurse? And I call the fucking nurse. And the nurse comes over and she's like, this IV is fine. She's like, can you just do it again? So the nurse had to take the fucking IV out, put it in again at the same place.
Did she have the same pain?
No, she didn't.
Well, maybe that. I think that does happen sometimes. I don't know why.
The nurse said the IV was fine, but like the nurse introduced me as a student.
Oh yeah.
And I think that's
tough.
what like fucked her up.
Dude, yeah, who you are is a big deal. Like if you're introduced as a student, that could really yeah.
So
people just don't have confidence.
I go on, I'm like, hey, you know, my name is, you know, Ken. I'm part of the nephrology team.
That's good. I haven't done that. That's good.
I just leave the student out of there. You know, we're almost doctors. We're almost able to say it.
We definitely are almost doctors.
And the response has been really positive. Like, oh, the doctor's here to see you, mom. or like, you know, whatever. They trust me. They're like, hey doc, can you answer this question for me? And I'm like, yeah, sure.
Yeah, dude. If I don't tell them I'm a med student or no one does, I mean, I'm a doc until proven otherwise.
Yeah.
Like I'm a I guess relatively tall white guy in a white lab coat. Like
Bro, you're 5'7". All right. You're tall like fucking in the Philippines.
I'm definitely not 5'7". But it honestly surprised me whenever anyone says I'm tall. I think I'm literally average height
No, you're
in
tall.
the United States, right?
No.
I thought 5'11" is, but
5'9" is average height in the U.S.
on Tinder I'm 6'1", so.
Yeah.
And on my football record.
Whoa.
All right, quiz time. You can't look at this.
I don't have my glasses on, dude. I can't
Okay,
read this
all right,
shit.
good. What is it called, Ken, when people are eating or craving things that are not food? Most common in people with anemia or low hemoglobin or who are pregnant.
Dude. This is like step 1 stuff.
They crave ice, dirt, or metal. Yeah, this is
Whoa.
some step 1 shit.
First of all, where'd the inspiration come from to ask this question?
I don't know. I just always thought it was an interesting thing.
Pica.
Why would you? Yeah, it's pica. Why would you ever crave fucking eating dirt?
You know, in back in SGU when we were like learning about this shit, one of the guys in my group was talking about it. He's like, so pica is like when you want to eat things that aren't food, like, you know, my shoes or this desk. And he knocked on it. And for some reason, I thought that was hilarious. I'll never forget it. That's why I remember pica.
Well, I'm glad he got it in your head. Whatever it takes.
I've never seen anyone, you know, have
I've
that,
never
though.
seen anyone with that. I think I talked to a couple doctors asking them, and they've never seen it either. But
And I had like probably 20 patients so far with like low hemoglobin.
I've seen because I think the idea is that the person's trying to get iron somehow, and you know, dirt might have iron, things like that might have iron in it, so the body like craves it.
You know, that's what I thought too, but it doesn't make sense. Cause wood
It doesn't
have
make
it.
sense. Okay, sure, it doesn't make sense, but
Ice
it kind
definitely
of
doesn't
does.
have fucking iron.
Yeah, that's true. That's true. Yeah, I don't quite get it, but there's some kind of function going
Yeah,
on there.
must be
Maybe it's
something.
misplaced, but it's something.
Is there more to this quiz?
That was it.
The easiest quiz ever.
That was a very easy quiz.
You know, my brother just got diagnosed with something.
Pica?
No, something worse.
Oh.
It's this congenital thing. His fibula, the small bone in your leg. So there's like the big one in the middle, and then on the right, the
tibia.
lateral side, fibula. The tibia is the big one.
Yeah, I know. That's what I'm saying.
And it pops out of place. So he'll
Oh, the
just
fibula and by the knee?
Yeah. Like
Oh.
right here by your knee on the right
Oh, okay.
side. Like it pops out. And so his cartilage is like malformed. And so it doesn't hold it into place. And what he does is anytime he twists it, it comes out.
Ooh.
So he's not able to twist
it
his
painful?
leg. It's not painful.
Huh.
And it's just always has fluid collection when it pops out. And he just pushes it back in.
Dang.
And it like
He's had that
locks
for a
in
while?
since birth.
So he must see orthopedic for that?
No, it started getting worse.
Oh.
So he's had it for like a while, and it's usually was like fine. He had like a knee brace, and he was able to do everything: squat, you know, what's that workout where you work your calves,
Yeah.
whatever the calf workout. Like all this other stuff he could do, but like if it's compound movements with your leg or like twisting movements, it pops out. And so now he's looking for an orthopedic surgeon, but it's apparently so rare that like my dad, who's also a doctor, was looking this up on like PubMed, and he wasn't able to find a single
Wow.
case report or like anything regarding this like
That's wild.
condition. Yeah.
Because they have some pretty rare shit on there, so it's pretty crazy.
So he's trying to find an orthopedic surgeon to like get him repaired, but like there's really no way. Like you could do probably arthroscopy to see what's going on.
Have you palpated it when it's come out before or no?
I have never
Oh.
touched it.
There was one time, this was due to trauma, but I almost said his race. So this guy came in, and his patella, the like kneecap, it was out of place. I think he had fallen from a building or something,
Oh, wow.
and then it landed right on his knee. But his patella was like lower than it's supposed to be, and
That's not good.
So the doctor in the ortho clinic, he pulls me out of a room. He's like, "Yo, you go check this shit out." And he's sitting there, and he's pretty calm. He's not like freaking out or anything. But I go down, on my knees, which is always kind of a weird position. with the guy sitting there. But then I'm like pressing on his knee where his kneecap's supposed to be, and it's just soft. I'm like, oh my god, this is not good. And then you can kind of feel where the tendon is supposed to be, and it's just not there. And then I can feel the top and the bottom of where the tendon is.
You felt the gap, right?
Yeah, I felt the gap. I'm like, oh shit. And then I felt the kneecap lower. I'm like, oh man, that's crazy.
Wild presentation. I had the similar guy, but like he just had a big fucking like tumor on the side of his leg or his knee.
Like a bone tumor? What was it?
It was no, it was a fat tumor. And so when I went, it was literally this big. Like I don't know how to describe that.
Yeah.
Like,
large.
10 centimeters
baseball
across.
size.
Bigger than a baseball. So I would press it and it was like squishy. He could walk fine, but he was having like a little bit of pain. It was just the weirdest thing I've ever seen. Like a fat tumor right by his knee. They couldn't take it out for some reason. It was crazy. Some of the stuff you see that happens is like wild.
Yeah, we see some crazy shit. I mean, this is a good place to see crazy shit, I think.
Even in like 2 years.
Yo, did you ever see the crazy shit at SGU? The like pretty much like carnival of crazy things that one guy brought in?
Who?
I forget the doctor's name, but it was just one day we went way up into the top of a building and we had multiple patients there, and whatever, we were seeing them. This was the array of patients. One of them was a room of two guys young, like 25 or so, with rheumatic heart disease. But it was so significant that you could, outside of their chest. So normally you have to like listen with a stethoscope and you can maybe hear a faint murmur on someone, even when it's pretty intense.
It's tough.
It's really hard to hear. These guys, you didn't have to use a stethoscope. You could be right here with your ear outside their chest and you'd hear click, 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 click on both of them, bro. Just their aorta just going bop, bop. It was like a clock in their chest.
I think you told me about that one. Yeah.
Yeah, and I was like, holy shit. And they both had this huge gaping scar where they had surgery. Like, oh my
Jesus.
God.
That sucks for
they're
like
not
a young
exactly
person.
advanced over there, so it is what it is. But then another one was this woman who had like major clonus going on. So you would, everything's fine about her, totally normal, but then you hit her knee with a hammer and her leg would just, I don't know if I could show it here, but it would just go and it just wouldn't stop until you grabbed it and like held on to it.
Whoa.
And then it would stop. But yeah, I think she had a stroke at one point, and then it just, yeah, she had like 3+ reflexes and clonus.
Okay. This is not the hot one, right? You said there was a hot one.
You remember this story.
I remember the hot one.
And this was when I was like convinced. I'm like, if I see a very pretty patient, like I don't know if I'll hold back. Like I think I am. I've gotten much better, but but yeah. Then the last patient.
Wait,
was,
before you get into
well, there's
it,
2 more, but
like if you see a pretty patient now, do you compliment her?
I haven't.
Okay.
No, I haven't.
Okay. That's just all I wanted to know.
Yeah.
Okay. Continue.
Okay, so then there's the very cute one. Pretty woman, I don't know, late 20s. But she had a mitral valve thing. And we had to like go figure out what was wrong and whatever. We figured out it was mitral valve. I forget why, maybe it was I think it was rheumatic fever too. And so I listen. I can definitely hear it. And then, yeah, she kind of like helps us out. But then she's like, it was like the first time I'd flirted with a patient. So she's like,
first of many.
I am asking her more questions, right? And everyone else is done.
Do you have a boyfriend?
And then I was like, so, what do you like in bed?
You're single or do you have your own place?
So how long have you had this murmur? Okay, yeah. And how do you like to get fucked?
Does it affect your love life at all?
Yeah. But that's actually kind of what happened. I was like, so do you have any kids? Which was so random. I mean, so not pertinent. But then she said no, and that she can't have kids because the doctor recommended that her heart can't take it, which I forget what percentage of ejection fraction they don't recommend you have a kid. But she's like, yeah, I think I'll never have a child because of it. I'm like, oh, dang, that sucks. I'm like, so you single or what's up? No, I didn't say that.
That's the time.
But damn, man, we had like major eye contact going on, and I'm like, maybe I should have fucking asked her. I think she would have been down, but I was like, maybe don't start this unprofessional career off of it. I haven't even become a doctor yet. Like, let's fucking.
You know the crazy thing?
Huh?
Her husband was in the room, right?
That would be crazy.
He's like, yeah, corner. Baby, keep going.
Oh my god! Come on,
He's the
bro.
cock.
Come on, bro. And then there's one more. I think it was the least crazy one, but she had a thyroid issue. Thyroid's like in your neck. It takes care of it's like an endocrine organ, whatever. It like takes care of your metabolism, your
It keeps you
heats, your
normally
cold.
cold temperature.
Yeah, like
It does everything.
it does a lot, honestly. It's kind of magic. I kind of just see it as like a magic organ, I guess. But it's just this like little like tie thing, shaped thing in your throat.
This is a review like time, talking about what the thyroid does.
Yeah. And so she had hyperthyroidism, so there was too much thyroid hormone, and so then they had to do surgery. Oh no, they did iodine ablation or whatever, radiation. Yeah. So then that took care of it. So I forget what they do, but I think you swallow radiated iodine, right? And then that goes straight to the thyroid.
That sounds like it
and
makes
that's
sense.
yeah, and that's more of a, I think, a poor nation type procedure. I don't think they do that in the US. But anyway, so then took care of her thyroid, right? But now she has hypothyroidism, so then she has to take like levothyroxine, things like it's thyroid. So that it can take care of it. And then she was having other problems, and then she was like, she pretty much just had all the crazy symptoms, you know. So what is it?
Her fucking eyes were popping out.
Her eyes were fucking popping out of her head, and
she was like hot as shit. Skin was
so
like...
sexy. No, yeah, like physically hot. Yeah, stuff like that.
There was like skin dryness or some shit.
And she said it felt like death. Like when she had hyperthyroidism, she was the most gratuitous, I guess, is that the word, patient I've ever seen. She was like, you know, a doctor or whatever his name is, Leroy, like saved my life. I'm so grateful to him for everything. He saved my life. She said it like 8 times during our interview, and we were like the 100th medical students she saw that day. You know, it's like, damn, how many times have you said this? At this rate, 800, I believe. But yeah, it was kind of cool.
I like that. You know, when patients are like, they understand. A lot of people just don't understand. Like, they think it's easy. You come in, you get a procedure, and your life is saved, whatever you have. But it's not like that. Like, it takes a lot of work just to, figure out what to do. And then doing that thing, like, there's so many complications. Like, even just giving antibiotics, you have so much stuff to look out for.
Yeah. There's a lot of prep that goes into it. A lot of, unbeknownst things.
I like when patients, when they're leaving, are like, thank you for, like, you know, everything you did. And I'm like, hey, I'm just a student, okay? They're like, you know, I liked your energy. I was like, okay, thanks.
But we do get paid nothing, so I have a tip jar out front if you
yeah, please. No, it's nice, especially like the old ladies that are like, you know, very thankful. I feel like old ladies are more than old
ladies
men.
are very thankful.
Yeah.
And the women that are like in their 50s, they're the most thankful. But I think it's mostly because they're like horny. Dude, this might be the last thing, but this he's not a program director, but he led the medical student program at one of my old hospitals, and he mentioned it was only guys in the room at this time, only guy medical students, and so he was doing, I guess, his like guy talk, and he's like, I love this guy, by the way, but he's like, okay guys, the ones you got to look out for the most, the ones you have to be most fearful of, is the 50-year-old women. He's like, you have to be terrified of them at all times. If they are unclothing themselves, you look away and you tell them, I will examine you once you have like recovered up, you know, your private parts or whatever, you know, be as professional as you possibly can, because that's how you get fucked. Like, that's how you get screwed, is that kind of stuff. So I'm like, damn, that's kind of interesting.
So they're the ones that go after you.
Yeah, I guess they're just like,
so they
hot
tease,
and horny. I don't know.
They tease, and then they're like, nope, you can't look, no touching.
I don't know. I don't think it's that. They want you to look and stuff, but then that's how you get in trouble and get sued and shit. Is that kind of a thing? I don't know who would do it, but maybe someone who sees you or something. But I don't know. And it might not even be your fault. You know, you go in there and then she's like taking her clothes off, whatever. I don't know what would be happening. She's shaking your ass for you or something.
You know, it's surprising, but there's not a lot of sexual tension in those hospital rooms.
Zero. I think the only time I've had it was with that one girl, and we weren't even in a hospital.
Yeah, exactly. Like, if you're in...
That is crazy. That's a good point.
You know, I was in actually a room with this, like, she was, you know... Outside the hospital, she's probably like a 7 or an 8. In the hospital, she was like a fucking 4, bro. I don't know what it does, but...
Yeah, it does do something.
You're in that gown.
That's true.
You're in the room. You look disheveled. Yeah. You're a mess. You know, she was passed out for a lot of the time. It just it knocks you down a peg, you know?
Yeah, that's a good point.
You could have the prettiest girl come in, and you wouldn't really, like, you know, think too much about it. Like, it'd be weird because there's not a lot of pretty girls coming in.
But here's the thing. I bet there are a good amount of pretty girls coming in. Not a ton, but there are some. There are
Yeah, of
some.
course, there's
Okay, maybe not
some, you know,
inpatient, but
but,
like
like-
yeah, to the ED for instance. There was way more pretty girls in Brooklyn than were coming into the ED. You know what I mean? And yeah, maybe they don't come in very often, but the ones that did, I bet yeah, it's to your point. They were probably disheveled and they're just not as cute looking. You know?
Yeah, and
They're
plus,
not done up. They
you
didn't get
know,
their hair did today.
one of the worst things is I feel like everyone's just getting too fat.
That's a big thing, man.
Like-
Yeah, I mean, especially. I mean, you were talking about how in the city people were fit, and I was like, I don't know, bro.
I think
almost
fitter
think
than
the opposite.
fitter than like the national average. But you know, whenever I saw a girl come in who's like 23, I went over always overweight, and I don't know what it was.
Bottom
Maybe it was
overweight.
just the old hospital, maybe it's the locale. But
One more thing before we're done.
Mm-hmm.
Have you heard of the thrifty gene?
it sounds familiar.
You should look it up. I mean, it's pretty simple, but it's pretty much people in. I'm gonna get this wrong, but I'm just gonna simplify it too. Black people and like Indian people and Pakistani, like that kind of
That's
area. They all just suck. That's what so there's apparently it's a theory, but there's like this thrifty gene and that's why they're more susceptible to diabetes and stuff like that, is because they're more like the women especially, but also the men are more ready for their bodies to starve for a while, and then once the food comes back, like in hunter-gatherer societies for instance, or the agricultural harvest comes in, then they're ready to eat. So that's why the diabetes is more prevalent in those populations, because they're just more, their bodies are more able to starve for a longer period of time.
I don't know if I agree with that.
Yeah, I don't know if I agree with it either. I'm just saying it's like not widely accepted, but it's definitely known amongst like a lot of physicians and scientists.
I guess it makes sense, but I don't know why it wouldn't apply to just everyone.
It doesn't explain a ton of stuff, but
Yeah.
no, I don't know.
I thought you meant like they were good with money or something when you said thrifty.
No, that's the Jews. Okay, and that's the end of the podcast. Man, we probably talked about race more than any other one, and we were trying to hold off.
This is the race podcast, and now we're not going to do that anymore after this.
Yeah, this is it. This was our last time, and
Probably.
and we're calling it. It was like a cheat day. All right, so hit us up if you have any questions for us at thatisunprofessional@gmail.com. Thatisunprofessional@gmail.com. If you have any comments, questions, or articles you want us to check out, appreciate you guys, and we will talk to you
Till next time.
time.
Yeah.
Doses.